Hi everyone, welcome back to our channel. Today, we're taking you inside a real-life dermatology procedure, a punch biopsy and shave excision of a mole located right here on the forehead. This type of procedure is very common, safe, and often done under local anesthesia. Whether you are a medical student, a practitioner, or just curious about how mole removals work, this video will walk you through every step. Moles can appear anywhere on the body and are usually harmless. However, when a mole changes in size, shape, or color, or becomes irritated, your dermatologist might recommend removing it for examination. In this case, the mole has been slightly raised and recently changed color, so we'll perform a punch biopsy for diagnosis, followed by a shave excision to remove the remaining tissue.
Alright, so today we are going to be removing a mole on the forehead with the punch biopsy technique, as well as a second mole right beside it with the shave excision technique. The one in the middle of the forehead, it's been there for many years, about 20 years or so. And we are going to remove it and send it for the histopathology just to make sure that it's all good. The other one, I think, is just a cherry angioma, and that we will just remove it via shave excision and electrocautery. So first, we will numb the area.
First, the area around the mole is cleaned thoroughly using an antiseptic solution to prevent infection.
This is the only part that will be painful, okay?
Got it.
Here comes the poke.
Next, we'll inject a small amount of local anesthetic, usually lidocaine, to numb the area. This ensures the patient feels no pain during the procedure, only a little pressure or movement.
The other one right there. Poke. I'm just going to cover your face with the drape so you can keep the sterile feel.
Now we're performing the punch biopsy. The punch tool, typically 3 to 4 millimeters in diameter, is pressed gently against the mole and rotated to remove a cylindrical core of tissue.
Do you feel anything?
Yep.
This tissue sample will later be sent to the lab for a histopathologic examination, which helps confirm if the mole is benign or requires further evaluation. Once the tissue core is lifted, we apply gentle pressure to control bleeding. The sample is carefully placed in a labeled specimen container containing formalin solution and sent to pathology.
Are you okay? Do you feel anything?
I feel a little bit, but it's not. I feel something.
Okay, just the pressure maybe? Because you're nicely numb in the whole area.
Okay.
there are vessels traveling from this area, so it tends to bleed a lot. Just apply some pressure with the aluminum chloride. I'll start working on the other one. You can keep the pressure on this one, and I'll work on the other one. Just keep it there. Now the second one we're going to remove is this lesion. This is the cherry and geoma.
After obtaining the biopsy sample, we move on to the shave excision. This technique removes the raised portion of the mole that remains on the surface. Using a sterile scalpel or dermablade, the clinician gently shaves parallel to the skin surface, carefully removing the lesion without going too deep.
I'm going to use the electrocautery just to remove some of those capillaries at the base. This will do heal the face. We'll dress the area with some Band-Aid. So the sutures will come off in about 10 days.
Okay.
And
So just a question.
yes.
Will this mole grow back?
No.
Okay.
Because I removed it from the root.
Okay.
That's the technique I use.
Mm-hmm.
So where all the roots and everything is out, so it will not grow back.
Thank you.
You're welcome. The other one, cherry and geoma, I just shaved it off. So maybe it may come back. Hopefully not. But
Will there
that
be a
one-
purple spot there?
Hopefully not.
Okay.
Punch biopsy and shave excision are simple, effective procedures that allow us to both diagnose and treat skin lesions safely. If you notice any new or changing moles, especially on visible areas like your face, don't ignore them. Early evaluation by a qualified clinician can make all the difference. If you found this video helpful, please give it a thumbs up, subscribe for more real clinic insights, and drop your questions in the comments below.